Hi, I'm Dr. David Stoker, board-certified plastic surgeon in Los Angeles. Today's topic that I wanted to discuss is one of my favorites, the tummy tuck. A lot of people will ask me, who is a candidate for a tummy tuck? And that's a good question, and there's a broad answer to that. It can be a man or a woman. Typically for guys, it's after a significant amount of weight loss or some type of surgery in the lower abdomen that's created unwanted scarring. Also for some guys who are super fit, but maybe in their late 50s or 60s, and they feel like their skin on their abdomen is getting wrinkly, especially when their clothes push on it. Those are frequently candidates for tummy tucks. But the most common candidates for tummy tuck are moms. After having their babies, the vast majority of moms have stretch marks on their lower abdomens. They have muscles that are stretched out, causing a diastasis recti. They may have extra skin and extra fat, perhaps depressed C-section scars or thick C-section scars. All of those are prime reasons why we would consider doing a tummy tuck. The last category that I would say is on women is following significant weight loss. I do see these days a lot of patients who have lost, let's say, 50 or 100 pounds. In general, I don't like doing a tummy tuck on a young woman before babies. However, if there's a severe amount of skin laxity or muscle laxity on the abdomen, and if it's really affecting them psychologically, interfering with their ability to have personal relationships, we'll discuss the pros and cons, but in those cases, I often will recommend a tummy tuck as well. I also think of two main different categories of tummy tuck. The more common one is restoring somebody's form and figure, either after significant weight loss or most commonly after having babies. Many patients come in, especially moms after babies, saying, I just want my body back. What can you do to help me, Dr. Stoker? The second category that I also do is when we're trying to enhance somebody above and beyond what they would appear normally. So there might be a very fit person who's never gone through some transition, such as having babies or significant weight loss, but they want more definition on their abdomen. They want tighter skin. They want a tighter pubic area and tighter anterior thighs. All of those can also be good reasons to perform a tummy tuck. Another question I receive often from patients is, how can I best prepare for my tummy tuck? Well, it depends on the actual case, but in general, the closer the patient can be to their ideal weight, the more helpful it is to me. If they are leaner, I'm going to be able to remove more skin and tighten them more and give them the best possible result without any variation after the surgery. It is not necessary to be at your ideal weight to perform a tummy tuck, but it is optimal. The other thing, of course, we want to be careful about is making sure the patient isn't too overweight. And that's something I decide on an individual basis with the patients. Aside from controlling their weight and optimizing their fitness, I would also say optimizing their nutrition is really important. A tummy tuck is a big operation, and you want to make sure that they have well-balanced meals, high-protein diets, because they're going to need a lot of that protein to heal from the surgery, and we want to make sure that there's no vitamin deficiency. Third thing that we want to do is to make sure they're not getting excess sun on their skin. Sun is very traumatic. Those ultraviolet rays essentially create a little bit of a burn that then triggers melanin to grow. I don't like seeing sun or burns on the abdominal skin before I operate on the patient. And the last one is kind of a funny one, but it's also serious. For God's sakes, clean your belly button before surgery. A lot of patients come in, they have cotton in there or something else in there, and the nurses do a very good job at cleaning them, but we prefer and make sure that they know in their preoperative instructions, clean their belly buttons before they come in for surgery. It's Dr. David Stoker, board-certified plastic surgeon in Los Angeles.